Have you ever heard about sex OCD or masturbation OCD? These are types of obsessive compulsive disorder known as OCD, which trigger uncontrollable recurring thoughts and behaviors that individuals feel compelled to repeat incessantly. Sex OCD and masturbation OCD are more common than you might think, yet they often fly under the radar due to their sensitive nature. They're characterized by intrusive, often distressing thoughts about sexual behavior and practices. Many people are unaware that they might be suffering from these forms of OCD. Experts in the field of psychology and psychiatry have studied these conditions extensively. They provide us with invaluable insights into the complex terrain of sex OCD and masturbation OCD. For instance, Dr. Stephen Philipson, a renowned clinical psychologist, has offered this perspective. Sexual obsessions in OCD are recurrent unwanted sexual thoughts. They can manifest as the fear of being attracted to something unwanted, taboo, or morally unacceptable. On the other hand, Dr. Monica Williams, a clinical psychologist and associate professor at the University of Connecticut, has shed light on masturbation OCD. She states, "Masturbation OCD can cause distress and interfere with daily life. Individuals may spend a significant amount of time grappling with these intrusive thoughts." This testimony from leading experts underscores the profound impact these conditions can have. They're not merely eccentricities or quirks, but serious issues that can disrupt the rhythm of everyday life. As these experts highlight, sex OCD and masturbation OCD can have a significant impact on a person's life. To summarize what we've discussed today, we dove into the complexities of sex obsessive compulsive disorder and masturbation obsessive compulsive disorder. We learned that these are specific subtypes of OCD where a person experiences persistent, unwanted thoughts and anxieties related to sexual activity or masturbation. We stressed that these thoughts are intrusive and can cause significant distress, often leading to compulsive behaviors aimed at reducing the anxiety. We also touched on the prevalence of these disorders. They are not as uncommon as one might think, affecting a significant portion of the population across various age groups and demographics. We must remember there's no need for shame or secrecy. These conditions are part of the larger conversation about mental health. The expert opinions we explored emphasize that sex OCD and masturbation OCD are serious conditions, but they are treatable. Therapies such as cognitive behavioral therapy, exposure and response prevention, and medication can be effective in managing symptoms. It's essential to understand that seeking professional help is not a sign of weakness, but a step towards wellness. We hope this discussion has shed light on these often misunderstood conditions. Remember, if you or someone you know is dealing with these issues, it's important to seek professional help. You're not alone, and there are resources available to help you manage these conditions.